Can I get a verbal yes? Because I've hidden all my cameras.
Oh, yes. Yeah.
Yes.
Okay, thank you. All right, I'll get started. So this is just going to be a little training, mostly in lecture form, of how I go about finding leads, scheduling interviews, doing that in a delicate, ethical, equitable way that doesn't scare people, and also, sort of accomplishes our goals in advocacy, in inviting people into the conversation and to be advocates themselves. So let's get started here. So key points to cover are going to be, why do we tell stories? And some of you have probably heard my spiel on this before, so I'll try to breeze through it, about why stories are effective and how they make an impact on us biologically. We're going to talk about how we identify story leads, interview best practices, and the most important part of story collection, which I think is trust and consent, and the relationship building between story bankers and storytellers themselves. Oh, I didn't even know I added transitions into this. It's so lovely. I hope it's coming through on your all's end, how nice this presentation turned out. So why do we tell stories? Thank you, Kim. Why do we tell stories? Mostly because they're effective, like they get the job done. There's a reason why all the best advertising is through storytelling, why religion is all about storytelling, why all your favorite teachers who are probably really good storytellers is because they grab your attention and stimulate emotions in you that make you care about the subject and make you invested and want to learn more or take action. This goes a long way towards sort of depoliticizing and taking the tension down from some conversations that can be hard, especially when people are going into them with a lot of preconceived baggage from their own experiences or information that they have been exposed to. Framing those difficult or sensitive issue areas by putting a real human face to them really sort of takes about all of the what about isms and the what ifs and the hypothetical arguments that people will use, and grounds it in reality. And so you're talking about a real person and how this issue affects them in real life, day to day, on the ground. It also makes data memorable. I'll talk about, the story's effect on the brain and how a narrative that's connected to information is more likely to sink in and be connected to your own experiences and stimulate learning and the ability to go forward with your own opinions on a subject. It's also really good for inspiring action. That's why, a really well thought out ad campaign can make you buy something. It's why the Sarah McLachlan commercials, in the arms of the angels, and you see all the sad dogs that are dying if you don't send the money. That's because your brain is being tricked into caring about them because it's connected to music, which is a sense memory. It's being connected to images of sad puppies. This is a terrible analogy, by the way. The storytelling we do, I think, is a little more targeted than the ASPCA, but it's the same basic principle, is that if you can grab somebody's attention and make them feel some type of way, if you can trigger their emotions towards a subject, you're going to inspire them towards action, whether that's donating to a campaign, voting for a candidate or initiative or a policy, sharing something on social media, whatever your goal is, whatever your ask is. A story is the best way to trigger someone into, acting on it and interacting with the information that you're trying to get out. The fourth reason that we tell stories, and a really important one, I think, is that we want to engage and empower the communities that we're talking about, right? We can have hypothetical conversations over here. I'm looking at the Capitol building right now from my window. Not many of those folks who have been elected have ever been hungry, have ever been without housing, have ever experienced addiction firsthand. Not many of them have been pregnant or can get pregnant. One of them is Black. So that there's a frame of experience that is not reflected in our representation. And it's our job to bring the stories of the people who do not have a seat at that table to the conversation, to pull up a chair and put down a dinner plate and the whole, seat at the table analogy that I can go on and on about, to make sure that they have a voice that's not just being used as what I like to call poverty porn, which is not something I can say in a larger 60-person Zoom meeting about storytelling, but it's a exploitative framework that often creeps into journalism in Appalachia and storytelling that does not center the people as the heroes of their own story. And so what we want to do when we are storytelling for advocacy purposes is invite those people not just to share their story and contribute to the policy actions that we're trying to accomplish, but invite them to be advocates themselves and participate in solving the issues that are facing them and their communities and their families. Amplifying those voices bridges the gap and helps us to have empathy for people whose experiences that we don't share. And that goes, for you and me and the people we meet along the way. That goes for our lawmakers. That goes for folks federally who've never been to West Virginia, who have their own opinions of the people out here and what we may and may not deserve. The only way to break down that stigma and to uplift those voices is to collect the stories and invite people to be a part of the process. The other important part of that is that people know what they need. We can hypothesize about what poor people need and how to get it to them, but the people who actually know what the needs are in the community and the most effective and impactful way to solve them are the people who live in that community, who are interacting with folks on a daily basis, who witness the barriers and the gaps in access and service to healthcare, to housing, to nutrition, to all kinds of things that should be a right and are difficult for some people in West Virginia. The other thing is that it helps regular people who are experiencing the same thing realize that A, there are services available, and B, that they're not the only person going through that someone in their own community or not far away is dealing with the same thing. And it hopefully will empower them to either A, seek out those services or share their own story to solve the problem long-term for other people. So this is my favorite part. This is the science of storytelling, which is what I was talking about before about why stories actually impact your brain and have a biological trigger to help you care about, not help you care about something, but manipulate you into caring about something. Again, whether that's a religion or an advertisement, entertainment, all of it is storytelling. And the reason that we crave it and we seek it out and we go to see plays and movies and we watch TV is because we want those biological centers triggered, and we want to feel those good emotions and be flooded with the chemicals of dopamine and oxytocin, which I'm also going to tell you about in a second. So this is your brain. It's just a cross section of a brain, and don't ask me to name all the parts. It's been too long since my basic psychology class in college, but I can tell you that there's a bunch of different lobes and cortexes, and they all do very important things. Gosh, I sound like a real professional now, don't I? Huh? I can talk like this around you guys. I don't know about other places, but so this is your brain, and the parts of it that light up or are triggered or begin to work and move and send messages to each other when you're reading a fact sheet, when you're looking at graphs and percentages. I'm picturing this as me trying to absorb basic algebra in high school. Like I understand the numbers go on a scale, some are smaller than the other ones, and you can subtract and add and divide. I'm not synthesizing that information or making any meaningful connections. I'm just accepting the fact as you're presenting it that 2 + 2 = 4. I can do better math than that, but I won't go down that rabbit hole. So this is your brain on stories. when you connect that same information in the fact sheet to a compelling narrative, to a human face, to a person who looks like you, sounds like you, lives geographically close to you, these are all the things that start to happen in your brain. You are flooded with oxytocin, which is the love drug, which is the same chemical that's released when, you know, mothers are breastfeeding, or when you fall in love with your boyfriend, or you know, you're eating delicious ice cream. It's that pleasure chemical that is going to give you more empathy, more generosity towards strangers. It's going to build trust between you and someone you may have never met before, and also a kinship that's going to automatically make you start to care about that person and seek out ways to help them, because that's what we do as human beings. We go out of our way to help one another if we see a place where we can. You're also going to get dosed with dopamine, which is going to stimulate neural coupling, which is what happens when you see information, absorb it, and connect it to your own experiences, making your own inferences of coming out with an opinion that's not just been told to you, but that has been processed in your head and you can then defend and feel more strongly about. The other thing that's not on this graph, excuse me, are the sense memories that get triggered. So all these different parts of your brain will light up when they're reminded of familiar scents, sounds, visuals. That's why the Sarah McLachlan ASPCA commercial is so effective, is because you hear that mournful sound and you see the sad puppies. Essentially, the same thing happens when you hear someone who has the same accent as you, or who grew up in the same holler as your cousin or your mom or whoever it is. You start to build a connection with that person and you care about them and you want to act on their behalf in their interest. Stories as advocacy tools. So how do we take this information that we have about stories in the brain and why they're effective and why we use them, and sort of shoehorn them into our own purposes? We use them to educate lawmakers and policy people, both here locally in West Virginia and on a national scale. Again, folks who've never been to West Virginia but seem to have very strong opinions about the people here. Shaping the media narrative, which, you know, there's always going to be one. I believe that we have the power to take control of it and use our own voices to sort of hey, bud, can you turn the volume down on your game, please, while I'm talking on my meeting? Thank you. Sorry. I'm that easily distracted. It's not even really that loud. I'm sorry, bud. Shaping the media narrative and also moving the public. So neighbor to neighbor, this is what I'm experiencing. And it doesn't have to be that way. This is how we solve the problem. We use stories in public speaking and in talking to lawmakers, like I said. Just when I made this presentation originally, it was closer to September 11th. And, you know, as many of you know, every single year, those firefighters and first responders have to go back and ask for the funding that pays for their health care and the damage that was caused to their bodies and psyches on September 11th, which, you know, the government promised that they would pay for, and they have to go back and tell their story every single year to make sure that that funding is renewed. And every single year it is renewed because, quite frankly, how do you say no to that? How do you say no to a man who's now in a wheelchair and is using oxygen because he was searching through rubble to find any possible survivors? The same is true of a coal miner in West Virginia who was at work from years just trying to earn a living for his family and ends up with black lung or COPD. He probably got that mine job fresh out of high school, and so he's not familiar with the benefits and rights that are available to him. There are advocacy groups, thankfully, now that try to be that cushion and that safety net for folks who aren't aware of the resources that are available. But it's important that we not only talk to the powers that be, but the people that may not be aware that services exist, and that, quite frankly, they have a right to them. like I said, we use them for educational media and letting the public know what they have a right to and what's available. And we do that in a variety of different ways. Some people may be great speakers. Hunter, I know specifically, did a really, really good video for us. One or two videos, I think, that explained their experience with Medicaid. And it's a really compelling piece. And, seeing somebody speak, hearing their kid in the background makes you care about them, gives you a kinship and again, an empathy for that person. We do digital ads like this one for Donna and Todd, and public service announcements and calls to action. Written content like blogs and letters to the editor and op-eds, as well as direct social media outreach to individuals. So, how do we go about this in a way that both serves our purposes as advocates and nonprofit organizations, but also fulfills our obligations as human beings to be ethical and equitable and transparent and responsible to the individuals who we're going to and asking them to share sometimes what are very traumatic situations and experiences that come with a lot of baggage and shame and all kinds of other, negative emotions that, quite frankly, why should they give us their story? So we want to make sure that we're being completely transparent all the way through. We all have an agenda. Nobody works for free. Nobody works for no reason. We're not just calling up people out of the blue because we're trying to make friends and we want to hear about you. We want to share these stories publicly and use them to advocate for what, at the end of the day, are public policies, which have political connotations and, have a certain level of exposure that come on with them. So we want to make sure that going into the conversation and at every point of the conversation, folks know who we are, what we're about, and make sure that they feel that they have the agency to withdraw their consent at any time if they change their mind, and know at all times what's happening with their story and feel empowered to be a part of it. Being collaborative is a huge part of building that trust, so that every step of the way, you're shaping the narrative in a way that reflects the storyteller's authentic voice, right? We want to resist against the urge to over edit people or just get the smallest little sound bite that will fit into, whatever commercial or video or mass call that we're doing. We want to make sure that we're preserving the storyteller's authentic voice, because at the end of the day, that's their main value, is that it's a real person. And we want to make sure that every story doesn't come out just sounding like Mariah Plant. It should sound like the person who lived it and experienced it. And so we want to be collaborative in shaping that narrative every step of the way. I'm often a little bit too communicative in talking with storytellers and little tweaks I make. I once sent a woman, I think, 5 emails in a week, which amounted to changes in commas and moving a paragraph from one place to the other. And I do that because that was a really sensitive story about a family member who had passed away. And I wanted to make sure that 100% was speaking on behalf of the family in a way that they were behind. But also, I want to make sure that they know that I'm not trying to get one around on them. Like I said, there's a long history of people coming into Appalachia and sort of extracting trauma to use for their own benefit. And like I said, poverty porn, which is the narrative that we're all sort of uneducated hillbillies who vote against our own interests and, don't care to be better. When in reality, we're hardworking folks who deserve the same access to resources that people all over the country have, but don't know that exists, or that we deserve better because we've never experienced better in a lot of cases, especially folks that may have never lived anywhere else but West Virginia. Ethical, equitable story collection. Gosh, I said that so well, so fast. Ethical, equitable story collection is also mutually beneficial. So we're not just saying, hey, thanks for your time. Have a wonderful evening. I'm going to go put this on Facebook. There should be something in it for everyone, whether that's professional, personal fulfillment in being a part of the advocacy movement and elevating their their profile or their access to the political conversation, whether that's compensation straight up in cash or gift cards or backpacks or donations towards another cause, because we want to reflect the value added of these stories, because it's not just a nothing project. They really matter and they really change people. And ask anybody who knows Joe Manchin on a personal level, stories work on him. He likes to talk to people, and he very much feels accountable to folks who wear coveralls to work. Not that he's ever experienced that, but he's somebody who is known to respond to a good narrative, to a good story, and he loves to bring it up in his own arguments. So if we can supply him with those compelling stories that reflect our needs and our values, we're getting him a little further down the field to being on our team. So now I'm going to go through step by step sort of how I go about the actual story collection and interview process. Step one is, of course, identifying storytelling needs and leads. So that's what stories do you need for whatever policy, event, action you're advocating for. Right now, we're all scrambling around to get Build Back Better passed, or whatever version of it we can get passed. So talking to Eve, you guys are looking for high prescription drug prices, and feel free to fill in or correct me if I'm wrong, Eve, or anybody else who knows better than me. High prescription drug prices, so folks who show up at the pharmacy and can't afford their medication, whether that's an SSRI that just helps you function through the day a little bit better. I know I've had to personally leave my mental health medication at the counter before because I couldn't afford the payment when the deductible flipped over. That can be folks who are living with diabetes, who've lost or dropped their insulin, and who have decided to use less of it so that they can ration it for whatever reason because it's so expensive. Part of Build Back Better would be to cap the insulin payout out of pocket from, I believe, $300 a vial. That's like this big, Kim, right? To $35, which I think we can all agree is far more reasonable and accessible to 90% of Americans. It's not free. It should be free, but we're getting our way there. So high prescription drug prices, uninsured West Virginians, that's folks who don't receive insurance policies through their employer, who make too much money for Medicaid or Medicare, but who cannot comfortably afford a marketplace plan or private insurance. I myself turned 26 11 days ago. I have 16, about 2 weeks left on my parents' insurance before I have a new $300 monthly expense. So if I don't, get my stuff on the ball and get that done and lower my car payment and stop buying my fancy crackers at the grocery store, I will be an uninsured West Virginian. My finances are changing because I've been kicked off my parents' health insurance and I'm a real grown up now. And that's kind of scary for me because, I've got this dude to worry about and I've got my own health concerns, and that's a reality that I'm facing on a very personal level right now. Also, people who can endorse the Affordable Care Act and the American Rescue Plan. Folks who have marketplace insurance who were uninsured and couldn't afford private insurance or didn't have insurance provided through an employer or Medicaid or Medicare, who because of the Affordable Care Act now have an affordable plan. And even better, have been able to take advantage of the lowered premiums and subsidies and tax credits that we're also trying to make permanent with Build Back Better. The other one that y'all are looking for, I believe, are Medicaid and Medicare stories, which are, of course, our two favorite programs on earth. This is virtually free healthcare for low-income people, folks with disabilities, the elderly, people that I feel that as a responsibility, that as a society, as West Virginians, certainly it's in our heritage to take care of our own. We have to support these programs, and we have to prove why they're important and why they work. So Medicaid and Medicare stories are always a huge priority because we want to keep those programs alive and well funded. Are you talking to me? Rude. Okay. So who can be a storyteller? Literally anyone. Anybody who has ever struggled to afford to access quality healthcare in West Virginia. Anyone who's concerned about their family member being able to access quality healthcare in West Virginia. It can be your family and friends, your coworkers, your neighbors, your healthcare providers. Those perspectives are few and far between because people don't want to get fired. I'm not in the business of getting people fired, and neither should any of us be. So often healthcare providers prefer to remain anonymous, and I would go into the conversation that way. Home and community-based care workers. So that's folks who work in nursing homes and long-term care facilities, people who are home healthcare aides. I myself am now getting certified to be a healthcare aide. It's more people than you would think getting paid less than they deserve. And we really need to hear from those folks about their experiences and prove the case for why they should be trained better and paid more. You can also be a healthcare storyteller. Yes, even you. I know Jude has shared his story with me. Hunter has shared their story with me. Kim has shared their story with me about their daughter. Anyone can be a healthcare storyteller. And you can do it in so many different ways because not every sharing method is right for everyone. Okay. Step 2. Pre-interview. Once you've identified your target, your subject, don't call them that to their face. It'll freak them out. Your storyteller. Go on and again, go through your informed consent and being transparent and letting them know exactly who you are and what you're about, your levels of exposure, which I'll get into, and prep for recording. It's important to record your interviews, even if you're not going to use that recording as a part of your content or your finished package. You want to be able to go back and transcribe the conversation afterwards, rather than like frantically taking notes on every single thing. You want to, listen, make eye contact, have a conversation so you can be present in the moment and then go back and get those details later. I would also prep folks for about 40 to 60 minutes is typically where my interviews end up. I also do a lot of small talk. I often cringe when listening to my own interviews back because I'm just talking about myself and no one wants to hear that, or I don't want to hear that, but it actually is effective in building that relationship. And, someone went to the same high school as my brother, or, someone worked at the same place that I did in high school. It's important to make those connections as, another human being, rather than just trying to extract tons of information. So let me just go into a little bit more detail about that. So I've said this over and over again, transparent and informed consent. So we've talked about transparency, laying all your cards on the table, being clear about your agenda, your organization, who you work for, what you're about, what type of information you're trying to get, and what it's going to be used for, to the best of your ability. Sometimes we don't know exactly what we're going to use it for until we have the conversation. And so it's sort of important to have this transparency and consent convo on both ends of the interview, because sometimes people will talk to you and it'll be a really, really good, deep conversation. And then they get to the end and they're like, I don't know if I'm comfortable telling the world what I just told you as an individual. So it's important to revisit the consent conversation afterwards. I know I've definitely had folks where the conversation got real, real deep. And, we go into talking about issues with different family members, folks who have not given their consent to share their experience. And people will come back to me either at the end of the interview or even a day or two later and be like, hey, I'm not actually comfortable sharing that part of my story. So it's important that folks know that they are more than welcome to change their mind, withdraw consent, take something out of their story, and that goes into the collaborative editing process that I talked about. It's just important to make sure that people aren't sharing their story because they've made a connection with you as a person and they feel responsible to let you have it. It really should be a collaboration, and they should feel welcome and empowered to change their mind, as people are wont to do. The other really, really important thing is obtaining privacy photo and video releases depending on your needs. The privacy release is across the board something that you need from everybody, regardless of if they're sharing their real name or if they're going to be anonymous. You just have to have it for legal purposes. I don't know what can happen to you if you don't have them. No one's ever asked to see them. Well, sometimes when you send them to, national folks, they want to see them, but I don't know how much trouble I can get into for not having them, but I don't want to find out. So I'll show you real quickly. Let's see. I'm trying to be smart about this. Okay. Can you all see this story collection consent form?
Yes.
Thank you. So this is the one that we use at West Virginians for Affordable Healthcare. I would say one of your first steps as a group and as a story bank would be to replicate this form, edit it for your own purposes. Basically, it just goes through some of the basic, who am I? What's my name? Where do I live? What's my zip code and phone number? It's important to make clear that this isn't information you're going to share with anyone. It's mostly for your own database and data banking purposes so that you can go back and renew consent later. Sometimes you'll have a story that you use for something this year, and then 2 years later, we have the same issue come up again. We want to use the story again. We got to get back in contact with someone. Oh, shoot, their email changed. Let me try and give them a call. Their phone number changed. Let me send them a postcard to their place, or let me see if I can add them on Facebook. It's just making sure that you have better access to folks going forward should you need it. And it's also important in vetting stories and making sure that you're, talking to real people, and it's not just Mariah Plant typing up a bunch of fiction stories at her house all day. So this is also an important part of documenting what information folks are and are not willing to share publicly. I'll talk about this a little bit later. The ladder of consent, or the levels of consent, how much people are willing to share. So you can go just your first name and your town. You can be anonymous. You can add a photograph of yourself. Adding a photograph of yourself and your family is a whole other level of exposure. Doing a video is a whole other level of exposure. So this helps you sort of keep track, and all of it dumps into an Excel spreadsheet. Helps you keep track of everything that folks are willing to share and not share. And they can go back in and change this at any time if they're more comfortable sharing more information or they want to share less. This is a living document and is really useful for keeping track of all of that. It's also important to have this electronic signature component here. That is going to do whatever legal thing is necessary to make sure that whoever looks at this believes that it's a real person signing off on this. You've got the date of your signature. There's also a page on here for minor consent so that a parent can also sign off on it if you're talking to somebody under the age of 18. This again is just a really important tool for keeping track of your stories, as well as what information you can and cannot share about people. I'll go back to my, oops. You'd think after 2 years, I'd know how to use Zoom a little bit better. Can you all see my presentation again?
Yes.
I'm insecure. I think everyone's left me. Also, I recognize that I'm droning on, and we're coming to 2 o'clock. If anyone has to hop off, I totally understand, and I can share the presentation with you later. I'm going to keep plowing through here. The other important thing, though, is to provide resources on what policies you're going to be using their story to advocate for, and examples of how you package stories. So I'll often send people a blog or a video to sort of give them a sample of what I'm talking about when I say storytelling advocacy, which sometimes people haven't heard of. This is just a cute little snapshot of my consent form and all the things that I ask. We went over that. I'll just touch on this very briefly because I sort of did it with the consent form. These are the levels of exposure. Not everything is right for everybody, even if they're willing to be 100% on the top of this ladder of first name, last name, where I live, photo, video, public speaking, talking to lawmakers. Sometimes you have a conversation with someone and you have to reflect on, maybe this person isn't the best voice for our organization, for our issue, even if they're passionate. Is it in their best interest and the best interest of the goals that we have legislatively to put this person on a public face? That doesn't mean that person isn't a valuable storyteller. They can be just as valuable in a written version of their story or in a highly edited video that you control the narrative of. Some people don't want to share their name or where they live at all because, you know, a lot of these issues come with the burden of shame and stigma and, you know, secrets that they don't necessarily want out in the world or told to their family or associated with them. That's fine too. An anonymous storyteller who I give a fake name to is just as valuable to me as somebody who's willing to go the full gambit and you know, share every part of themselves. You also want to prep that person for recording. Let them know that you are going to be recording either you know, just like we're recording the Zoom here today. I do a lot of interviews on Zoom that I record to the cloud. If you're just recording with a phone for their audio, let them know that that's happening. Just be very, again, clear and transparent, not necessarily that you're going to use this recording, but that you're using it for transcription purposes. And I had meant to include a link to the transcription service that I use, but I'll send that to you all after this. It's super useful to pop that into a computer, and most of the services cost money. You have a billion emails between the 6 of you, so you should be able to get enough free trials to get some interviews done. But it's so time consuming to sit there and listen to like every single word and get it word perfect as you're typing it out. Get a transcription service that just does it for you in 5 minutes, and then go back through and highlight the key points and the good quotes so that you can start stringing together a narrative. If you are going to be using that video or audio, ask your storyteller to prep themselves in a quiet, well-lit room with their device on landscape mode so that you have a little bit more options with framing that picture in post editing. If people have kids in the background of their interview, don't get stressed out. I was stressed out the first time that happened to me. And I thought, oh no, the audio is going to be ruined and you won't be able to understand anything. And this person's distracted. No, that's a real person in their real house with their real kids running around and screaming. It doesn't get realer than that. So embrace, you know, where people are at and who they're coming to you as, and, you know, include who they are as real actual people. Don't try to polish folks up. Like I say, don't put lipstick on a pig. Not that any of our storytellers are pigs, but it's an expression. You don't pretend that you're somebody that you're not. I talked to India about this the other day, is that when we're our authentic selves is when we're our most powerful and our most compelling. So don't be afraid to include all the y'alls and ain'ts and might couldas, even if it's not grammatically correct. Keep all that in, because that's the authentic voice of the storyteller. So step 3, the actual interview. We're just now getting to the conversation, guys. Wow. I'll speed through these. Interview do's and don'ts during this conversation. Start casually, be a normal human being who's having a conversation with another human being. Ask them about their kids and their job, and their husband or their wife or their partner, what they do for fun. Learn who they are outside of the context of this healthcare conversation, because, we're trying to prove the point that people aren't case numbers. It's a quality thing, not a quantity thing. So we want to learn about them as qualitative human beings. Matt, can you turn that down, please? Listen first, then ask for clarifying details. Resist the urge to interject the first time someone tells their story. I would say give them a little bit of background about what you're interested in hearing about, and then give them the floor to speak openly on their experience, to give a synopsis, and then go back in, take some handwritten notes, notice where the policy issues manifest and contextualize in their story, and compound and intersect with one another. Then ask for those clarifying details. And one of the things that I always ask, which is a little uncomfortable, but I explain why I'm asking, is what's your income? And that's important to know, obviously, because you want to know what programs people are eligible for. And it helps you sort of frame their situation in context of what policies apply to them even. It's not something that you're ever going to type up in a story or have them quoted as saying, because that's A, it's not interesting to hear exactly what somebody makes, and B, there's other ways to make that clear without actually saying a number. So get the income information, the insurance information, whatever relevant services that they take advantage of. If they have insurance, what services do they access with that insurance? What services can they not access? Because even with insurance, it's too expensive. Ask those little clarifying details that will sort of get you towards where you're trying to go in terms of building a holistic story of this person. When you finish the conversation, be gracious, be thankful, be clear and strategic about next steps. And I say strategic in parentheses because of, again, folks that may be gung-ho to be on camera and talk to reporters and all this kind of stuff, but may not be media ready yet. So sometimes people need a little bit of training, or they need a little bit of time as an anonymous storyteller before they're willing to add a photo or their name or speak in front of people. Sometimes it's a pathway, and that change and go up and down as your relationship ebbs and flows. Also do something. If you're not, update them. Keep in touch, let them know that you're here for them. Sometimes, again, these conversations can be difficult and evocative. Let them know that it's okay to be a little bit on edge after that conversation. Let them know that you're there for them should they need you, and let them know again that they have total agency to withdraw consent at any time. If they wake up in the middle of the night in a cold sweat saying, I should not have told that lady all that information about me and my doctor's situation, send me an email, send me a text, call me first thing in the morning, and it's gone. Make it clear that you're on their team and you're going to do what's best for them. Do not assume that everybody understands policy like we understand policy, because we work in it and regular folks don't. They're not interested in it. They don't want to hear about it. So resist the urge to over-educate folks, even though that's, what we do. And meet people where they're at in terms of syntax and language. A lot of people who are on Medicaid, for instance, don't call it Medicaid. They don't say I'm on Medicaid or I have Medicaid. They say I have a medical card. That's just the colloquial way of expressing it. And so pick up on those, learn them, and explain them later on in your writing rather than correcting them. I guess I just decided not to finish that sentence. I assume that was going to say, don't use leading questions or manipulate the narrative. So don't, start a fire where there's no smoke. let somebody tell their story. And if it's applicable to your purposes, great. If it's not, you should probably look harder, because I bet it is. And B, if it's not, it's not. It'll probably be useful for something later on. If not, you've met a lovely person and had a nice conversation. Don't add something where there isn't anything. Otherwise, you're going to get into a very awkward, uncomfortable situation later. Just don't lie is really what that should say. Don't use leading questions or lie. Don't share people's stories or personal information without renewed consent. So I'll often get an email from like a national organization saying, we need a story about this, this, and this, with no background information about what they're going to use it for, who's going to see it, how they compensate folks. So I will often call myself the troll that lives under the bridge, because I consider it my job to protect my storytellers and make sure that I'm not putting them in situations where, you know, I say, go talk to this person, and then they talk to them and either don't get the money they were promised or are exposed and exploited in a way that they didn't sign up for. So it's important that you are protective of your storytellers and make sure that you're not just, you know, fulfilling your deliverables or you know, your advocacy needs, your campaign needs. You're fulfilling their needs as a human being and as a storyteller and as a person who took the risk of sharing their experience with you. Again, resist the urge to over edit and misrepresent facts to fit your agenda. Don't take out the y'alls and ain'ts and might couldas. Make sure you preserve that storyteller's voice, and don't over interject all of your own good education and knowledge and opinions into somebody else's experience and story. Last thing, story development. What makes a good story? So this is what you've probably seen somewhere in elementary school. It's a narrative flow chart of how, you know, we build tension and empathy in a story. We come to a climax and then we zoom out to a resolution and our call to action. So I would normally play a video at this juncture, but I want to speed us along because I am far over the hour here. But usually I'll play a video of a storyteller and then I'll sort of go along this. Bye, Matt. See you later. This chart and graph out how I sort of use the formula to explain. I guess he's leaving the house. Matt, where are you going? I'm sorry.
Go on, Mariah. Go see where he's going. You're fine.
As long as I don't hear a door open, I feel confident.
He's doing a great job. He is.
What he is impatient for lunch. That's what it is. I'm sorry.
No, go ahead.
I won't be able to speak correctly. Coming back up.
Hey, Lisa DP.
He's just walking around. Okay. So I'll often use a storyteller who's also a executive director of the Gilmer County FRN, Ms. Jessica Greenleaf, I'm a big fan of. She was very helpful to us last year in passing the Medicaid postpartum care for 12 months up from 2 months, which is, as anyone who's ever had a baby or known anyone who's had a baby knows, you don't recover in 2 months from that, especially when you have compounding health issues like Jessica did that ended up in an emergency C-section, which is major surgery. So the snapshot is who this person is as an individual, where they live, what their home life is like. Oftentimes people are, because we live in West Virginia, are involved in their community. I always try to include that if someone's a volunteer firefighter or a postman or a veteran or anything like that, where they are involved in serving their community. It's important to highlight that and celebrate that as a part of their story. I'll weave in quotes about how the challenges that they faced because of the policy thing that we're up against made them have to, you know, make some tough decisions or forego treatment that they needed or would have given them a better quality of life, and how all of these things start to build, especially in terms of medical debt. You know, once you've had like an accident or a medical issue, you have to have all of the doctor's appointments, and then the surgery, and then the follow-up care, and then the physical therapy, and then the equipment, and it all sort of stacks on top of each other. And then when one more thing goes wrong, it can feel like there's no way out. And it's important to capture that emotion in a way that also still respects the experience of the person as a real human being. At your climax and turning point, you're going to talk about your policy issue, whatever desire was met, whatever need was met or not met. The crucial point of the story where somebody either found their way out of a situation or the situation got much worse, and is something that we need to take quick and decisive action on. In Jessica's case, because of her Medicaid being ended just 60 days after her emergency C-section, she lost out on a critical period of time where she needed additional care, but couldn't afford it, and therefore never received it because it's now too late. And her quality of life is not as good as it could be had she had access to 12 months of postpartum care, which of course now women in West Virginia do up to 12 months. We're grateful for that. Unfortunately, it was too late for Jessica to take advantage of. And that's why, you know, we need to thank our legislators for pushing it through. Clap, clap, clap. We also need to make sure that this is available to women nationwide. And we also need to support folks like Jessica going forward as their kids get older, through things like the child tax care credit and CHIP and Medicaid expansion and all of those other good things that we're all working towards. And then the big picture, which I already sort of touched on, the larger political and policy conversation. That's where you put in your data. It's now contextualized from that original fact sheet, which only stimulated the cognitive language processing part of your brain. Now that all of this other good emotional stuff is lit up in your head, you can receive this data in a way where you're going to couple it with your own experiences, feel strongly about helping that individual and people like them, and actually take action to do that. And this is, I think, the closing line of that video that we made about Jessica's story, about how the Medicaid extension to cover pregnant women and postpartum women up to 300% of the federal poverty rate would have helped her so much and will help women going forward. That's a little bit of repetition on my part, I apologize. So this is that same chart as before, now with her experiences slotted in. Snapshot, meet Jessica. You learned about her as a person and her cute little kids and her fiance and her house in Gilmer County. You heard about her health problems and her medical debt and how they keep stacking on top of each other. And so by the time she found herself pregnant with her second child, she had to make a decision of whether that was safe and affordable for her and her family. Turning point, Medicaid steps in to help, because now that she was pregnant, she was eligible for Medicaid. She was previously in that place where she was covered by an employer, but the insurance was so bad, it wouldn't even cover her ultrasounds. So she dropped that insurance and got Medicaid, took a pay cut in order to protect her child and her own health. And that's where she was able to get really, really quality, positive care, not just for herself, but also for her kids. Zoom out, she lost that care. She unfortunately suffered some medical consequences to that affect her lifestyle to this day. This is how you can help her and others like her. These are our takeaways. Storytelling works. It's impactful. It helps people find a common ground of being human beings who are looking each other in the eye and listening to an experience that you haven't had. And so now you care about them and you're going to vote in their best interests and donate in their best interests and think about someone other than yourself. That's why it works. That's why we do it. Not only that, people who have stories to share, they contribute actual tangible value added to advocacy efforts and help us fill those gaps, boots on the ground in the communities that need them. Number 3, good story making efforts are relationship driven, collaborative, and mutually beneficial for all parties. We are all now deputized as trolls under the bridge. We protect our storytellers, we advocate for their interests. We do so in a kind, compassionate, empathetic way that is always consent and transparency driven, that also helps us get our ball farther down the field towards getting more affordable, quality healthcare for all West Virginians. Okay, any questions?
That was a great presentation. I really, really enjoy the way you present this. You really got a gift for educating people on this. That's why I really wanted your video in our summit. I knew that, that would be really good and we could use it and share it. But for me, it's like the big question is, how do you get folks